Bob Eckel, one of the co-chairs of the Cardiometabolic Health Congress. And what we're here today to do is to do the CMHC West post-meeting recap. And the topic for us today is expert debates in nutrition. And I have with me Drs. Alice Littenstein and Monica Agrawald. And I'm going to turn first to Monica to have her introduce herself and also for her to describe a bit about what she shared about plant-based diets. Monica?
Thank you so much. I am one of the preventative cardiologists at the University of Florida, and I do focus on advanced lipidology and lifestyle techniques to improve cardiovascular health. Those are my areas. I did a talk on plant-based nutrition, and we talked primarily about the importance of shifting away from a standard American diet and eating more plants in general. I try not to, in my clinic and in my practice, I don't try to advocate that everybody eat 100% plant-based as much as eating more plants. The goal is to eat 5 to 7 servings of fruits and vegetables per day. I think that anywhere shifting from a Mediterranean diet to 100% plant-based diet, between those two diets is the optimal diet for chronic ischemic heart disease and patients. As long as we're eating whole grains, lots of fruits and vegetables, nuts and seeds, beans and legumes, those are sort of optimal dietary intake goals, with the goal of also moving away from refined foods, high saturated fats. We have data that shows that eating more plants and eating a plant-based, more of a plant-focused, plant-based diet shows more vasodilatation of blood vessels, reduction of inflammatory markers, improvement in weight, blood pressure, and cholesterol, and really also pointing out that any shift away from the standard American diet towards more of a plant-focused diet is more optimal for everyone.
All right, thank you, Monica. I'm going to turn now to Dr. Alice Littenstein from Tufts. And Alice really has been a big fan of dietary patterns, and I think it builds to some extent on what Monica has just outlined. Alice, please recap your session if you could, please.
Okay, well, first, my name is Alice Littenstein, and I'm director of the Cardiovascular Nutrition Laboratory at the John Mayer USDA Human Nutrition Research Center on Aging at Tufts, and also the Gershoff Professor of Nutrition Science and Policy. And the focus of my talk was on dietary patterns, because I think what the data indicate is it's as important what you do eat to what you don't eat. And it's really everything's a balance, because particularly with macronutrients, if we modify one macronutrient, that is that carbohydrate or protein, then one of the other ones will change, because we rarely just eliminate something and in a sustained period of time lose weight. So in terms of dietary patterns, I think one of the important things is to emphasize the quality of the specific macronutrient. So as was indicated, whole grains as opposed to refined grains, unsaturated fat as opposed to saturated fat, and then a variety of protein sources. There are many plant-based proteins as animal-based proteins. And the advantage of plant-based is that they're lower in saturated fat, they're better for the environment. However, in general, there are many dietary patterns that are consistent with optimal health outcomes, particularly cardiovascular outcomes. And the important thing is to assess what your current dietary pattern is and then modify it in a way that's going to be sustainable, that you're going to be able to adhere to essentially for a lifetime. And I think if that's the approach that's used with patients, it'll be much more successful than suggesting that they make major changes. And then I briefly spoke about nutrient supplements, and there are really no good data to indicate that nutrient supplements are going to help with respect to cardiovascular disease. We had very high hopes with beta-carotene, with folate, with vitamin E, with vitamin C, and it all fell apart when we looked at the randomized controlled trials. And I suspect it's because people that consume high-quality diets are replete in most nutrients. And so pretty much that's where I ended up.
Thank you, Alice. Dr. Ron Krauss was also with us at Cardiometabolic Health Congress West, and his topic was low-carb diets. I'd like you both to comment just very, very briefly on the low-carb dietary approach. Monica, turning to you first in terms of the low-carb diet.
So I think that what I get concerned about with low carbohydrate diets is that people typically then will eat a high fat diet. And so I think that when we couple low carb with high fat, and that often is high saturated fat, I'm not sure that we are shifting towards a more optimal dietary pattern. Whereas if you do a low carbohydrate or low refined carbohydrate and just eat complex grains, or even if eliminate those and eat more plants and low saturated fat, it can be done. I mean, certainly people do a low carbohydrate, plant-based, more plant-focused diet, and I don't have any trouble with that. I think the data is compelling that carbohydrates that are refined for sure are not optimal. I think that people who typically eat more low carbohydrate often purport that they have lost weight and had significant drops in their LDL. But as Dr. Krauss pointed out with a really nice slide, that patients who eat those kind of diets really have a lot of variation in their lipid parameters. And so I think that as long as if we want to eat low carb and shift towards more plants still, and more, if we're going to eat carbs, more complex carbohydrates, I think that that is very reasonable. I just want to shift away from people thinking that low carb, high fat, or high saturated fat in particular is optimal.
In terms of body weight, what the data show is it doesn't really matter whether it's low carb, high carb, or in the middle, which is probably preferable. And there we have very good studies, the pound loss study, the diet fit study. So I think the focus shouldn't be on the level of fat and the dietary pattern. I think it really goes back to the quality of the different components. And that, again, goes to high quality protein, ensuring that we have healthy fats to avoid carbohydrate-induced hypertriglyceridemia. Always complex carbohydrate. It's very easy to consume that now because almost any product that's made with refined carbohydrate is now available in the whole grain form. So I think the focus shouldn't be on whether it's low carb, high carb. It really should be achieving and maintaining a healthy body weight, being physically active, and then a healthy dietary pattern.
Well, one final thought is the low carbohydrate diet, at least during the induction phase, is very difficult to sustain long term, and also may have some additional risks for cardiometabolic health. But nevertheless, we know people sometimes can lose more weight on the low carb diet, but remaining on a very low carb intake for a long period of time is very, very difficult. Well, again, thank you, Alice. Thank you, Monica, for recapping that session that was, I think, very successful at CMHC West. This topic remains an important one for Cardiometabolic Health Congresses going forward, and we're hopeful that you're going to be joining us for one of our future events. Thank you very much.